in some families who may not have been used to having much money around, in fact most of them have been used to having very little money because of the consequences of infections, they may need to have mediation services in case they don't agree. And I think it'd be a good idea if Sir Robert or others could consider whether that could be made available in the same way that other people who suddenly come into some degree of money can get some kind of help, because families sometimes don't find it easy to decide how money should be shared.
I thank my right honourable friend for his comments, and I pay tribute to the work that he's done and the constructive way he's engaged with me over the last 6 months and obviously many years before. He makes the point about his friend and the stigma that has been attached to some of the conditions that some of the victims have had to endure, and obviously that's why in the heads of loss that are reflected in the scheme. He makes some observations about how that better awareness of some of those conditions can be taken forward, and I will discuss that with my ministerial colleagues, and several of them from the Department of Health and Social Care are here today. He mentions my immediate predecessor, but I am very aware that a large number of Paymaster Generals, including one sat next to along from me today, have done an enormous amount of work to get us to this